refers to the absence of normal spleen function and is associated with some risk of serious infection. Splenic is a form of immunodeficiency, increasing the risk of sepsis from polysaccharide encapsulated bacteria. They are congenital and acquire asplenia. Application in medicine. Splenic patients are at risk for septicemia that are fatal in up 50% of cases. Splenic patients in whom fever develops should receive empirical antimicrobial therapy immediately. Vaccination against pneumococcal, Haemophilus influenzae type B, meningococcal, and influenza virus are recommended for splenic patients. Prophylactic antimicrobial therapy is generally recommended for splenic children younger than 5 years of age and may be considered for older children and adults during the initial 1–2 years after splenectomy. A video about surgical removal of the spleen.
Your doctor has recommended that you undergo a splenectomy, or spleen removal surgery. But what does that actually mean? The spleen is one of the organs in your body that works to clean your blood. The spleen is located behind the stomach and to the left of the liver. Specifically, the spleen picks out and destroys red blood cells that are no longer useful. A splenectomy is the surgical procedure used to permanently remove the spleen from the body. Reasons for removing the spleen vary. Most spleen removal surgery is performed in an emergency situation, during which internal bleeding may be putting a patient's life at risk. This program assumes, however, that you are not currently in an emergency setting. In your case, the reason for removing the spleen may be to treat a blood disease, blood congestion, Gaucher's disease, white blood cell deficiency, the growth of a tumor, or the growth of cysts. Occasionally, the spleen is removed as part of an action taken to determine the best course of treatment for Hodgkin's disease.
Pros. A splenic patient can continue his or her quiet life with proper precautions. Splenia helps produce more platelets when there are not enough in the body. There are another video.
Spleen is a small organ located behind the stomach in the left upper part of the abdomen. A mass of lymphoid tissue, it contains two distinct areas, the white pulp and the red pulp. The white pulp is distributed as tiny nodules of lymphatic tissue among the red pulp, which fills all the remaining space. The white pulp is responsible for the production of lymphocytes. Some lymphocytes enter the blood, while others remain in the spleen, where they ingest and destroy foreign or damaged cells. The red pulp contains many blood channels, expanded capillary lakes, which act as filters when blood is forced through them, removing damaged or abnormal red cells and allowing normal ones to pass through. The lymphocytes then engulf and destroy these damaged red cells. The spleen also acts as a store for red blood cells.
The cons. Mortality among patients with post-splenectomy sepsis can be as high as 50%. The reason for an increased risk of bloodstream infection among splenic patients are the impaired clearance of bacteria from the bloodstream and a humoral immunodeficiency. Increases the risk of spontaneous formation of clots in blood vessels, and if the clots moves to the lung or elsewhere, there is a risk of stroke. Individuals with splenia are much more prone than the rest of the population to super infections. Another video about the clot formation.
physiological conditions, a small tear can appear in the wall of a blood vessel in order to prevent blood loss. Platelets and coagulation factors, such as the pivotal factor 10, acting in a coordinated manner, close this wound. The platelets are responsible for a first sealing of the tear. Coagulation factors are activated, leading to the formation of cells which stabilize the growing clot. These processes can also be triggered inappropriately to the pathology of disease, and thromboembolic disorders can affect both types of blood vessels. Arterial or white clots are primarily triggered by the rupture of an atherosclerotic plaque. Arterial clots are platelet-rich. Venous or red clots, on the other hand, mainly consist of red blood cells and fibrin. Vascular injury, hypercoagulability of the blood, and venous stasis play a crucial role in their development. It is important to note that the formation of both types of clots, arterial and venous, always involves platelet.
Is sweat applied in Ecuador? Due to the increased risk of infection, doctors give oral antibiotics as a prophylaxis after surgical splenectomy. The duration varies suggested. One suggestion is the antibiotics are taken for 2 years. Patients are also cautioned to begin approving doses of antibiotics at the first appearance of an infection of the upper or lower respiratory tract or the onset of fever. Another video about symptoms of a rupture spleen.
When we think of circulation in our bodies, we commonly think of our blood. We think of the veins and arteries that transport it, and the heart that beats. There is, however, another circulatory system that exists in our bodies that is often overlooked. It is called the lymphatic system. It has its own pumping system, its own fluid called lymph fluid, and its own vessels called lymphatic vessels. While the blood delivers oxygen and nutrients to the cells, the lymph is responsible for removing waste products and fluids. If your body were a small city, then the lymphatic system would include often without your ever knowing.
What? The conclusion finally is that, as we know, the spleen is an organ that plays important roles in the cavity of the human being, as well as the elimination of all cells, but you can live without this organ taking precautions, as vaccine against germs, seek medical advice if there is fever, when there are dog bites because they can transmit bacteria. Without the spleen, these bacteria proliferate and can be severely damaged. The last video about spleen.